We are at 10 o'clock. Thank you all for taking the effort to come in, but it's always worth coming in to these meetings because it's one of the few times on a day like this that the air conditioning is something we can be appreciative of. If we could please remember to put all your phones onto silent, please, and devices, etc. That would be really helpful. Okay, so we can hear everyone. Okay, the agenda pack has been published online. As always, please refer to the page numbers when you're speaking to it, as it helps with members to find where they're going. There were a couple of supplementaries published which cover agenda items 6 and 7, which is there. When I invite people to speak, if you could clearly state your name so that anyone listening online is able to identify who's in the room. Audio recording is being made for this meeting. And finally, we now receive, agendas are now viewed electronically. They're available online in the agenda pack. For housekeeping, there are no expected fire alarms. Should this happen, follow the Democratic Services officers and move along as indicated. Thank you, everyone. Item 1 of the agenda is apologies for absence, please.
Thank you, Chair. Good morning, committee. We have received apologies from Councillor Lovell, for whom Councillor Hobhouse is substituting. We've also received apologies from Councillor Carswell and Joe Simons, one of our co-ops.
Thank you. Are there any other apologies for absence? Thank you, everyone, for taking the time to come along today. Item 2 of our agenda is declarations of interest. This is where you are asked to declare any interests which are relevant to the agenda item today and different from those already advertised on our website. Are there any declarations of interest? Okay, no, thank you very much. Item 3 of our agenda is minutes of the last meeting held on the 15th of May. What has changed a lot since the 15th of May that we're in at the moment? Any points or relevance or comments in relation to the agenda? Okay, are we happy that I sign them as a true record? There being no objections, I do that. Thank you very much. Item 4 is public question time.
None received.
I'm not aware of any, that's fine. So we move on to our work programme. Okay, you'll see that our next meeting, he says, trying to find it, is the 5th of August, which is going to be a different world, I imagine, one way or another when we get there. In the meantime, the agenda items that are highlighted there are a point. One of the things that I was looking to do, so one of the things that we're going to try to is we've had some conversations about academisation, academies and etc. One of the things that I'm going to try and see if we can do for the 5th of August, although obviously school breaks, etc., is to see whether we can get the Regional Schools Commissioner to come along and have a conversation with us. Realistically, there's no main agenda to it. It's just that one of the things that I think that would be interested for the committee to understand is when an academy is being re-advertised or look to move on, what the process is for academies and where they are, but also obviously how the council or how we as a committee can have some influence over the commissioner in what they do. As I say, I don't want to. It's not a hidden agenda. It's more a matter of let's see if we can and see an open conversation for questions. So that's one of the things I wanted to discuss there. Francis, did you want to come in?
Very briefly, I've been at meetings where recently where everybody is being pushed very hard towards academisation, and the question was okay. So how do we find out whether they're any good? And the answer was, oh, you'll know where you feel if they feel good to you. No, it's not good enough. Can we talk to the Regional Schools Commissioner about the kind of data that might be provided so people can actually know what they're doing?
Yeah. So again, we're a way off from this. We're going to make the invitation, but I wanted to make it clear that there was no hidden agenda for inviting the commissioner along. It's more a matter of just making sure. So it's an opportunity for us to understand what they do, and more a matter of. So it's along the lines of the brokership as well. And Claire.
I think we need to remember that by the 5th of August there may be a new government, and the regional commissioner is a DfE official, so DfE policy might be different or being made different at that point. So in terms of what they'll be able to say about DfE policy and their role, it might not be as clear as it would have been sort of a couple of months ago, or maybe they've.
No, I acknowledge that. And just to be clear, I'm mentioning it now so that you know that it's there. Potentially, as things develop, that might change. But the ability for us to, I think it's a topic that we would gain from one way or another. Even if the end result is that we end up with someone coming to talk to us at rebrokerage in a school and stuff like how that process works. At least we've made the effort. Potentially with the new government, we made an introduction, and we'll see where we go. So that's to Toby.
Chair, I think it's a fantastic idea. Could we push it back a bit rather than the August meeting? I wonder whether actually it would be better in September, because they would have had more time, and we might get more people around the table.
Okay, so I've put it on the agenda for August in an expectation that we might have to start dropping it. I don't want to have to start dropping it before. Let's make the introduction first. Let's see where we're going with it. And if because of time and motion and different things, the world changes around us, then we can deal with that. But making the approach now is at least a start, an opening gambit for it. John, were you indicating?
Don't know if I'm working. I am working good. Lovely. We get feedback on everyone's mics, bar yours, Mr. Chairman. All I wanted to say, actually, or shall I wait until she's done that? It's already facing the other way. Shall I not use the microphones? Is that all right? Good. Yeah, we had I have, and several other councillors have recently had sign-offs for academisation of schools within our division. I wonder what happened if we don't, if the council, obviously I did, and I'm assuming my fellow councillors did the same thing, but if we don't sign, I was unaware we had to do that. I'm happy to do that, but I was unaware we had to do that. And if we didn't, what would actually happen if we don't turn around and say, no, actually, I'm not very happy about that.
Just conscious that we're on the future agenda items, so I'll try to
Academisation for schools that are ordered to academise is an order from the Department of Education. So what you're signing off is effectively that the local authority is undertaking the process in an appropriate manner. And where schools choose to academise, the Department of Education mandates, if you like, or validates that choice. And again, we process the academisation, so you're signing off that we are again behaving appropriately in processing that academisation.
And the reason, just to continue, the reason that you members are getting that information is because of our decision-making process of the council, that local members need to be included when a decision is made in their relevant divisions. Henry.
I've had 2 primary schools academised in the last 6 months. On the first occasion, I tried to say I didn't want it, and I got a very firm email telling me I had to accept it because it was part of the process, not part of the decision-making process. I understand what you're saying, Lee, but I find it completely and utterly irrelevant for us to be consulted and then told that we can't accept any of thing apart from to accept it.
Okay, we're being slightly diverted. So what I'll do, I'll ask Fiona to make a note that we've had the conversation. And what I'll do, I'll ask Claire through her team to just get a little briefing note put together explaining the decision-making process and the influence that members have over a decision that we may not have any influence over. Because that's what the Constitution says, Henry. Okay, so that's the forward work programme. Anyone else on items that they may think we want to have a look at in our forward work programme? Okay, thank you very much. That's item 5 done. Moving on to item 6 of our agenda then, which is the Children's Services Transformation Plan. Members will remember that a couple of meetings ago, those members that are involved with the transformation and just kindly volunteered to get a little bit more interest, gave us a bit of feedback. I thought that was a really interesting part. Things have changed around the transformation plan slightly now, so I thought it would be a good opportunity to bring it back and maybe just look at the 4 areas in a little bit more depth, more just an opportunity to ask some questions in relation to it. So I believe Heather is going to introduce it, then we're going to pass over to Claire, and then we'll see where we go with it from there. Heather.
Thank you so much. I appreciate that. I'll make it really snappy on my part because the office. Oh, I'm sorry. Yes. I assume everybody knows who I am. Sorry about this. No, Heather Shearer. I'm lead member for Children, Family and Education, Families and Education. As the chair alluded, we have been working on a transformation programme, but we have made a huge change to it recently, or a very focused change to it recently. We want what we're presenting to you today looks slightly different to the one you've seen before, but that's because what we really want to do is identify the priority activities, but with a clear focus on outputs, if like outcomes really, rather than outputs, with a child in the centre, of course, as we always do with children in the centre. But we have clarified quite a lot, and the reason we've got into this in such depth, apart from it's the right thing to do, but we do recognise that there's a good deal of pressure in the system. And there are challenges for us all, so we need to make sure that going forward we're as effective as we possibly can be. So focusing on outcomes has to be the way forward. I'm not going to say too much more. I'm going to leave it to the officers to explain it, but I think it's quite clear, and a lot of work has been going into this to try to keep it as clear and as sensible as we can. So I'll hand over to the officers now. Thank you.
Thank you. So I'll take you through the overview of this and then hand over to service directors and officers to do the detail in each section. So this is, as Councillor Shearer says, the transformation programme for children's services. We've called it Included, Educated and Cared For to identify the priorities that we feel are the most important for children in Somerset. So included essentially means that children are included in their community, that we intervene as early as possible, or we put support in place as early as possible, that they're educated. We have big problems in terms of education in Somerset. And for those children for whom we're corporate parents, they have to be part of our priority. Our vision comes from the Children and Young People's Plan in terms of making sure children can grow up safe and a child-friendly county that supports them to be happy, healthy and prepared for adulthood. And we need to make sure that we're not just focused on the here and now, that we are focused on the future for these children in terms of how we can support them to be best placed to get to adulthood and be able to manage their adult life successfully and independently. So this slide that's on the screen now is about the priority work stream. So as Councillor Shearer said, we have changed the framework of this transformation programme to focus on outcomes. So these 4 headings in terms of the priority work streams are our ambitions in terms of a children's system, rather than just setting out the areas of work that we're going to do. So we firmly believe that local mainstream school is the right choice for most children. That's about including children in their community, making sure that children have the best opportunities to make friends, to be part of their community and to be supported in their community wherever possible. We recognise that some children, a small number of children, do need specialist education that is outside their own community, but we believe that we need to work harder with mainstream schools to make sure that children can be included in their local mainstream school wherever possible. We also need to help families access support early. We do have a good early help and prevention offer, but we need to make sure that we expand that, working with our partners and in communities to make sure that we have the right support in individual communities for families and children, rather than just as a county-wide resource. And the final 2 points, which we'll look at in a bit more detail in a minute, are developing an excellent workforce for children to make sure that we have the right staff in the right places to be able to work with those children and families consistently. So we, as most local authorities, have quite high turnover rates for social workers and in schools for teachers. They are increasingly difficult professions and people are struggling to remain in them. We need to make sure that we have the right staff in the right places to support those children consistently and build good relationships. And the final area is making sure that we have enough homes for our children who are in our care in Somerset. We do have significant numbers of children placed outside Somerset in care because we don't have sufficient homes, both residentially or in foster care. And we want to join that up now to make sure that the school places for children in care are sufficient in Somerset, because when you look at the data in terms of exclusions and children with not on school roles or on part-time timetables, the children who have both additional needs and children in care are a far higher proportion of that cohort than they should be. Okay, so these slides set out effectively the transformation board work that we've done. So this report is largely the report that we took to our transformation board in June, and the work that we've done under each area. So this is the progress summary that I presented at that meeting. So we've had our second meeting of the transformation board in June. It meets every 6 weeks. And we now have a finance board that's specifically for children's services to look at all the financial issues across the range of budgets that we manage in children's services, to try and help us understand how to manage those budgets better, because they overlap to a large degree. The majority of the projects under each work stream that will be discussed in a minute are now underway. There are a few that are still being scoped and worked up. We know that there are significant financial pressures across the system, and that is impacting on our capacity to do the work that we need to do. And there is a level of concern in relation to morale because of some uncertainty where some teams are going to restructure as part of the corporate restructuring process later in the year. That relates largely to the education services teams who need to restructure to manage the work differently and also to manage the budget pressures. We have had really good sessions with head teachers, which Amelia will talk to you about a bit more in a minute, about making changes to some of the ways we fund schools and to support inclusion in schools. And we have started to think about testing the neighbourhood way of working, which Richard will talk to you about in a minute, to make sure that we have a way forward that actually wraps around schools and communities better than it currently does. We have made some progress in recruiting foster carers, but we still have, as I said earlier, insufficient foster homes in Somerset, and there have been some delays to Homes and Horizons homes being opened. So we have the first 5 homes opened, but we have another 3 that are due to open by the end of this year, and that's impacting on our spend because we're having to use external provision because we don't have sufficient internal provision, and it's high cost, and therefore puts the savings we put in place at risk. And we have rising numbers of young people coming into care, which is causing a pressure on the budget because obviously more children means more spend. And that's largely in relation to the 10 to 15-year-old age group. So the reason that that's a significant pressure is that 10 to 15-year-olds tend to have more challenges and to be struggling more with life, if you like, and need greater support. So often there are not sufficient foster carers with enough expertise to be able to care for those children, and we're reliant on residential care, and sometimes that is outside the county, and that can be extremely expensive. So the next slide just looks at the overarching financial summary. I think this is largely reflected in the finance report that Christian will do later, so I won't go through that in any detail. And the next slide looks at the savings tracker in terms of the savings that are in place for children's services and where we are on track and where we're at risk. And again, I think that will be addressed by Christian in the finance report, so I won't go through that in any detail. So if we just move on then to the priority work streams and the work that each work stream is doing. If we start off with local mainstream school as the right choice for most children, I'll pass over to Amelia. Behind me. To give you some more detail on this area.
A little bit warm, stuck with on the M5 with no aircon. So the focus of this, as Claire's highlighted, is around really coming around our local mainstream schools. We have a number of work streams. The focus at the moment, so we've done a lot of detailed work. Some of these are absolutely in train. One of the messages, I think we shared this with you at previous meeting, was that both schools and settings saying very clearly to us, you need to move quickly. We cannot wait for some things to change, and we need to feel the impact of your changes on the ground right now. So some of the things that we're working on in this programme are really about moving quickly. And some of you in your inboxes may have had communications from residents about children who are stuck in the system. That has been our immediate focus, is identifying those children who have not been seeing sufficient progress and getting them. Usually it's because they haven't got a school place to go to because of the sufficiency pressures. Quite often it's just complicated, and we've had to just focus on saying what's the solution, who needs to be around the table, and how do we move quickly. So that has been a real focus, and I hope I hope that what you will start to see is fewer of these coming through, and that across our member contingent, you'll see fewer residents and schools raising with you that they have concern about a child where progress has not been rapid enough, because we have resolved a number of those cases. In terms of some of the things we're also working on at this moment. So we're looking at the EHCP process, and we will be saying more about that in detail in an item on this agenda. So we'll go into that because I know that's a concern to a number of people that, and this committee has been looking at that for some time. We're also having a lot of conversations about money. And we have had some informal conversations about the banding system, which is how we fund mainstream schools for children who have EHCPs. And what we've identified is that we have, where we have gone in and costed the statutory requirement in a plan, the amount that that costs is in the region of 3 times higher than what we would standardly give a school. And so when you look at some of the pressures that we have in the system of schools who are struggling to say that they can meet children's needs, they're not making it up. We have been underfunding them by a margin of probably 1 to 3 of what it actually costs. Now, that's obviously a big challenge because the budget is under pressure, but it doesn't feel right that we would expect the pressures to be resolved when we're asking people to do things that is simply and demonstrably unaffordable. So that's we'll be putting together formal proposals and doing a formal consultation to look at options to resolve this situation, and that's happening right now. The rest of the projects are progressing. Some of them are longer term, and you'll be aware of some of the sufficiency pressures and continuing to look at that, but looking at some things we can do quite quickly. And what's been great is the fast work of staff has identified areas where we can do things right now, and schools coming forward and saying, look, we can put in an extra classroom. Actually, we have some vacancies. We want to work with you, and the positivity is really very encouraging. So that's all things that are moving quite quickly, and we will come back and report on that in more detail when all of the projects are set up and fully fledged. But that's where the work stream is at this moment in time.
Thank you. Are we? Is that the end of that first part? Because we could. So
In terms of education.
So should we take questions now? Are you happy for that? If there are any, so we cover the points as we go. That would probably be. Any questions so far? Andy.
Thank you, Chair. I noticed one of the pressures is that having delays on the Homes and Horizons project with constructions. Can you elaborate on that a little bit? And is there anything that can be? Is that because of money from the council? Is that because we're not able to get the workmen in there to do that? Or the completion dates are just not happening, or what is that problem?
So there are various issues. So the money is there. The council committed to funding up to the first 8 homes, and that money is there. And we have funding for the Department for Education for those homes as well. The delays have been in relation to initially, last year there were 3 reviews of Homes and Horizons in terms of was it good value for money. And during that process, at least for the first 2, there was a sort of stop put on progressing the further homes while those reviews were undertaken. And we also have a real issue in relation to planners in the council. So we do not have enough planners to do the planning permission work, and to also in terms of property, because property obviously quite stretched in terms of the asset management work that's going on at the moment in terms of the savings, that their ability to work through the legal elements of the property purchase and the work that needs to be done, as well as the contracts for builders, etc., has not been as fast as we would have liked it to be. I'm not blaming them in any way, because actually there's pressures all through the system, but that has, all those elements have had an impact on the speed at which we've been able to turn around the setting up of those final 3 homes.
I mean, that's a little bit concerning, especially with internal issues not being able to, like the planning and the internal, purely because of the amount of money that we're spending outside the county on looking after these kids while the homes are not available. Surely that far more outweighs some of the savings that they're on about trying to make at the moment. We should be putting a bit of pressure on that.
I think what you're trying to say without putting words in your mouth is that this committee may be concerned that the other elements within the council may be slowing down process. It might be worth if just us noting that particular point and maybe at some point coming back to that. Mark.
Thank you, Chair. I mean, actually, one of mine was sort of partly on that because I assume you've got an not ever decreasing circle, never increasing circle. The bigger the delay, the more we spend, the less there is in the pot in the long run. So I think it's more than noting. I think it's more than stressing extreme concern, I think, as a committee, that, problems in other departments are going to have a knock-on effect to the budget that's actually going to affect quite vital services. With regard to that, can I just pick up, obviously, still a relative newbie to the committee. You talked about high turnover of social workers, etc., and I can maybe understand, the pressures, but then you also said high turnover of teachers. Again, is that in certain areas rather than, is it certain schools that have a higher turnover? Is it, and I presume we've identified them, but then what can we do to stop that high turnover? And I suppose we talk about the high turnover of social workers. Are they leaving the profession or are they leaving the authority to go elsewhere? I think that's a question. Or is it a bit like planners where all the local authorities are outbidding each other because they're so desperate for planners? I think I'll leave that. I note your concerns about slight concerns about the morale at the moment. I think it's probably more than slight concerns, I think, and I think that's, you've been very polite there. I think there's some severe concerns. I think this committee should note that, it needs, that morale problem, again, it'll be an ever increasing circle if we don't deal with it and deal with it quickly.
Okay, so in relation to workforce, the sort of crisis in terms of social workers and teachers is a national problem. So it's not anything specific to Somerset. We are working really hard with the Multi-Academy Trust, with our own schools, to try and support them in terms of recruiting and retaining staff. It is very difficult because we're in a market where people are in, those jobs are increasingly difficult with the sort of societal issues that are around at the moment, and people are really struggling to want to go into students, to become a student, to be a teacher or a social worker. So the market is drying up effectively because there are fewer people going in through that student route to qualify. In terms of social workers are not leaving in huge numbers, but our turnover is quite high compared to where it's been before. We are quite a low turnover rate as a local authority, but it has increased by about 3% over the last year. When social workers are leaving, they are usually leaving either to leave the profession entirely because they're burnt out, I would describe it as, it's too difficult, or they're leaving to go into the locum market. So if you're a social worker in a local authority, you're earning from the basic grade to sort of the top grade, if you like, between 30 and about £46,000 a year. If you're a locum social worker, you're earning between £80,000 and £120,000 a year. The government has put in some measures which mean that if you're a social worker who is less than 5 years qualified, you will no longer be able to become a locum social worker. I think people are trying to get in there before that comes in, basically, if they have fewer years service than 5. And it is, it's a huge disparity in income, isn't it? It's a very high differential. We have had people who've become locums who've come back to Somerset. Somerset is seen as a good place to work for children's social workers. It's a very supportive culture, you see from our Ofsted report 22. And working as a locum social worker, although it has financial advantage, is very difficult because you're working in local authorities where you are not effectively part of the permanent team. Quite often local authorities will give, we don't, but other local authorities, as reported by social workers coming back, give them very high caseloads. There isn't the same level of support that you'll get as a permanent member of staff. And obviously you don't have the benefits like pensions, etc., that you would have if you were a member of a permanent team. So there are pluses and negatives for social workers, and I think sometimes people have to put their foot in the water of the locum market because it looks so attractive, but people do tend to come back into the permanent staffing in Somerset, but over a period of time. usually takes 12 months to 2 years for people to turn that round and come back. So it can take a long time. And actually we don't have the supply effectively of social workers to be able to wait and hold those gaps, if you see what I mean, while we're waiting for people to come back.
I think Amelia wanted to come in, did you?
I was just going to add around the education market. So there have been some real pinch points in the workforce. And what we saw coming out of COVID was huge pressure in relation to the lowest paid roles. So there has been ongoing pressure in the early years sector, rising wages in supermarkets have overtaken the early years sector by some margin. But the responsibilities have not decreased. A lot of people find that work very rewarding, but there comes a point where the economic pressure just doesn't add up. We've also had a lot of pressure on roles like TAs and
Teaching assistants.
Teaching assistants, thank you. The teaching assistants quite often one-to-one, and if a child's situation in a school, if they have special educational needs, is that school, that child is dysregulated, there can be lashing out, there can be violence, there can be dysregulated behaviour, which can often impact on that TA, teaching assistant. And so there can be a lot of turnover because quite often those are not high paid roles. We also saw in the county that there was a real spike in head teachers leaving, and a lot of head teachers feeling that the role was unsupported. It was very difficult to recruit. We haven't seen the data. The data from government to see how we compare to the rest of the country takes a while to come through. But the word on the street from our associations and from colleagues on the ground is that the feel-good factor in the county is rising against the odds, and that there is, describe it as cautious optimism in our community. That's very fragile. That's very new, and the pressures are absolutely real, financial in terms of what's happening on the ground, the impact of the cost of living crisis that comes through the door in the school. But there are some green shoots and positivity about the direction the county is taking.
Thank you. Okay, I've got a couple of members already indicated. I'm going to start early on this one, just so that we can obviously, if we can start remembering. I want to cover everything as deeply as possible. So if we could be concise with our questions and then try and allow the opportunity to, it saves me chasing at the end for time. So I'm applying the same principles to all. So just be conscious of the time. So I'm going to take the two questions I have and then chuck one in, and then we'll move on to the second of the four areas. So Francis, please.
Just two questions, I hope briefly. One is the opportunity area work that was done right around the country some years ago. One part of the work was focused particularly on teacher retention and recruitment and different ways of going about it, particularly in rural areas. It was someone north of the country that worked really hard on that. The first question is there anything that we have taken from that? Is there anything we could take from that? That's one. The other one is absolutely get the need to concentrate on the hard cases. Absolutely get that. And it's working. What's the impact on other potentially lesser needs that still need to be looked at? And is there now getting to be a stuck set of things there, or how are we managing that?
Thank you. I'll just do a quick. I forgot to add previously while Amelia's getting her mind together to answer that question. Somerset has done a great deal of work when it comes to improving terms and conditions for our social workers. We've done some really positive things, which is one of the benefits we have. And I would suggest that there are some in previous minutes, if any of the members are interested in understanding that, it's an important point to make that Somerset has worked very hard to try and make our environment inviting for social workers, and that has helped us. I forgot to mention that before. Amelia.
I wouldn't say specifically there's something that leaps to mind that I would say that directly came from opportunity area learning. And if there's anything in particular you have in mind, I'd be very grateful for you to flag it. I think the things that are working now are the basics of good practice, making sure that people coming up through the ranks who want to move on are identified and deliberately supported with pathways into other roles. Our initial teacher training is focused on alternative routes into teaching, not just through traditional graduate routes, and identifying that potential, which I think particularly in rural areas where you haven't got a university and you haven't got people just tumbling out of university courses, you need to be thinking laterally about where your potential is for the workforce. I think those are the basics we're putting in place at the moment. In relation to capacity around hard cases, I think it's absolutely an interim focus. And I think when you are, when staff are overwhelmed, what it means is that that bleeds into cases that are not so difficult to resolve. And so what happens is that more and more cases then become delayed because the inability to move on in the really tricky ones bleeds out into the rest of the system. So that focus is absolutely intended to be an interim focus to restabilize, to get that backlog cleared, to resolve the situations for those families and children in schools who have been frustrated, and rightly so, but not for that to be a long-term measure. The lesson, though, I think, is that actually we need to be better at identifying where something may be tricky early on and dealing with that from the off to recognise it may need a different approach. So that lesson has already been embedded from that work.
Thank you. Okay, Peter.
Yeah, I feel I may have lost the moment, but it was about foster carers and lack of. Just wondering, we do advertise an awful lot. Is it effective? Is there any other formats we can use to actually attract more foster carers?
Yeah, we do an awful lot of advertising. And the person who does that in comms is absolutely brilliant. She won a national award for the campaign. Our aim at the moment is to recruit 10, doesn't sound many, but 10 net additional social workers every year for the next 3 years. So in 23-24 we achieved that, and we're on target to do that for 24-25. The problem with that is we've got increasing numbers of children in care. So we might increase our numbers of foster carers, but our children are probably outstretching that in terms of the numbers of children in the system, and the type of care they need as well, which may not always be suitable in terms of foster care. That we are part of a regional regional fostering hub that has just been set up as part of the government's response to Stable Homes Built on Love. That is providing a sort of regional hub and regional advertising campaigns to try and attract foster carers across the region. The people who are interested funnel into that regional hub, and then they're funneled back out again to local authorities to actually pick them up and do the work. So we're doing that on top of what we're doing locally as an additional measure. We do think we need to think about our recruitment campaigns, that they're good quality, but they're not having the impact in terms of volume and exactly the right people coming forward. So we do need to review that and look at other parts of the country to see how other people have done it and where other people may have done it more effectively to try and bolster that again.
It's a bit like me going on about being the rewarding nature of being a governor at a school. Foster carers are and they're a wonderful group of people that help and support us in our duties, as do carers, there are lots of volunteers there, and there's never enough to fill the gap. But I would always suggest the more you're aware of the need for foster carers and governors and all the other bit, you can bring that into your day-to-day roles. And thank you. That's the question. I've just got a quick one, Claire. The title of the thing is the work stream is called "Local Mainstream School is the Right Choice for Most Children." What do you mean by most?
I think, as I said at the beginning, for a very small cohort of children, they will need specialist school because of their level of difficulty or their specific levels of learning difficulty, for example. So for most children, the vast majority, can't give you a proportion, I'm afraid, it is better for those children as a holistic response to have an education in their local community where they'll make local friends, they'll have people to play with in their local community, they'll have links in their local community, and their family can seek support in their local community. When you isolate children effectively by taking them out of their community, and they tend to be the more vulnerable children who have those additional needs. When you take them outside that community, it's very difficult for that family to get the support they need, and for those children to build the social relationships they need to go into adulthood in the best way possible.
That was the point I wanted us to make, really, because very often we hear that the X is problematic, X is, Y is this, Y that. And one of the things, it's a very small number. The majority of our young people are happy and keen, and we support them as much as we support the ones that are in need. That was the point of so thank you. Move on.
So moving on to developing an excellent workforce for children, we have covered quite a lot of this, fortunately. If you could just move to the next slide, Fiona. So some of this I'll cover here, and some of this I'll leave to Richard to cover in terms of the Connect Somerset and accessing help early. So the neighbourhood working I will leave for Richard. The education restructure, I think we've talked about briefly in terms of needing to restructure education services to meet the needs of the current children's and schools population, particularly in terms of the focus on additional needs, SEND and exclusions, which are very high. We need to reconfigure so we have a greater focus on those. We've talked a bit about retaining and recruiting high quality staff. You can see the numbers there are they're quite alarming. 42 social worker vacancies is actually 7 social work teams, which we don't have basically. We've had to amalgamate teams because we don't have the staff to be able to populate those teams. That means that caseloads are getting very high and social workers are struggling. We have brought in some social work assistants to cover some of those vacancies, to do some of the work that doesn't have to be done by a social worker, but we don't want to maintain that because actually what the nice bit of social work is doing the work with children and families and helping those families recover rather than doing a lot of court work and paperwork. Social work assistants can't do the court work and paperwork, but they can meet with families under the direction of a social worker. So they're doing some of that work, but it's a bit of a double-edged sword because it's taking away the nice bits of the job for social workers while we try to recruit. We are looking at international recruitment, which we have done before. This will be our 3rd cohort of international recruits. It does work well. We need to make sure we support those international recruits well because they're actually coming in to a very different culture, a very different life, and a very different social work experience. If we had our establishment, as I've said there, of social workers, our caseloads would be okay. So a caseload should be 14 to 15 children. The reason for that is that we believe children need to have a relationship with their social worker. And in order to build a relationship with somebody, you do need to see them quite frequently. So we base the 14 to 15 on the basis that there are about 20 working days in every month, and that a social worker should see a child at least once a month. And that means that for a day a month, they have the opportunity to meet with the child and spend a lot of time with them and their family at least once, if not 2 half days. And the other 4 or 5 days of the month, they have to do the court work and the paperwork. But we set the caseloads up on that basis to give the capacity for building relationships. As you can see there, the average social work caseload is now just under 20. That is really pushing at that relationship-based approach and also pushing at the ability of social workers to do the increased paperwork that is required with the increased numbers of children on their caseload. So in terms of morale, despite the really severe challenges in most areas, I'd say, of social care, morale is actually quite good. People do feel supported by their managers. They're working hard in teams. Jane is doing a brilliant job in terms of supporting the social care workforce to feel included and listened to, and we're trying our best to try and support those staff to remain in those teams so children have the relationship with somebody who can actually help them. We are impacted in some places by insufficient office space with the asset sort of management and the change of buildings and leasing buildings to other organisations. That is reducing the space for social workers to be in offices in some parts of the county. That is creating an impact which we're having to try and manage as well. And then in terms of HR capacity, with, as we said earlier, in relation to planners and property, there is also a bit of an issue in terms of HR capacity with the work to reduce the workforce to keep us viable financially as an organisation. That means that the HR focus is on that piece of work and the HR capacity for services is not as high as it has been previously. We are managing that and they are working really hard with us to try and help us do that. The significant impact is on recruitment. So HR do a lot of recruitment work for social workers. The principal social worker has taken over that role in the interim, but there is a bit of pressure in the system in relation to that. And the workforce training programme I'll leave for Richard to cover in terms of the early support work. Any questions in relation to that?
Members, got Andy first.
Yeah, we've just heard the disparity between permanent staff and locum staff. How many locum staff do we have to employ in order to try and manage the teams? And if we're employing a lot of locum staff, wouldn't it be better just to pay our permanent staff that little bit more to encourage more permanent staff to come in? It just seems to be spending an awful lot of money in locum. I don't know what the numbers are, but if they are fairly high, we're going to be spending an awful lot of money on locum staff, where we could probably make savings by paying more, if you understand what I mean.
So there are 2 points there. So we have about between 25 and 28 locum social workers currently, and we still have 42 vacancies in terms of gaps. So there are quite significant numbers of locum staff in the system. We do have locum staff who've been with us for quite a long time, some for several years, because it's a good place to work, and actually we support them well, and we are really struggling to get to that sufficiency. We would rather have locum staff longer term if we can. If we can't, we'd rather have permanent staff, but if we can't get them, we'd rather have locums longer term so that they can build those relationships with children, because that's the really important bit for those children. In terms of paying more, it's tricky on several grounds. So as I described earlier, locum pay is between £80,000 and £120,000. That's the sort of salary you're looking at for a service director in the council currently. So actually, we can't pay those social workers that sort of level of salary, because it doesn't fit the structure, and it doesn't fit the grading system in terms of the pay and grading system in the council. So we are able to put retention and recruitment allowances of small amounts onto social work pay and to other people's pay, as other parts of the council do, to try and attract and retain staff. But it's not going to be sufficient, because the locum pay market outstrips it by so much. It's not a small gap.
To come back on that, how many of our staff leave permanent positions and they get retained within the authority as locums?
So we have a policy, or I have a policy, that we do not accept anybody who's a permanent member of staff back as a locum for 2 years.
Okay, thank you. Evie?
It's just a quick question. I don't expect you to go into detail. Overseas workers or workers that we're trying to bring to Somerset, how are we looking after them? Because I understand with the educational side of finding these placements and actually educational costs as well, are we providing that for these workers, social workers, please?
So we work with an agency who bring in social workers from abroad, and they bring them in cohorts, in groups. They do a lot of, we fund them to do quite a lot of training with those social workers before they come in. And when they come into this country and into Somerset, we would work with them to identify housing, school places, etc., so that they can actually live a normal life in Somerset. Does that answer your question?
Does that include like nursery costs and stuff? I'm just using an example that I met a social worker from another authority, and she had 3 very young children. It was a curious question of, do we help with nurseries and stuff, those sort of costs, please?
Not as a rule, but if somebody was having difficulty, we would look at it just as we would for our own staff.
Thank you. Marcus?
Thank you, Chair. Yeah, just touching on the locum issue, I don't know whether it's a whole local authority issue around the country, is that you can get qualified, then you'll go and become agency and get paid twice as much. And how do we stop that, as not just this council, but every council in the country, I suppose? We'll leave the next government to sort that one out, I think. With regard to, you mentioned caseloads, etc., and it's nice to know that obviously there is more caseload, but they're coping. But you said there's a limit because of the what's the word I'm looking for? Can't think of it, because there's a limit to how much they need to see the children and the families, etc. At what point are we in danger of? And I don't want to use the word wheels coming off, but at what point are we? At what point does it get to where actually the caseload is too much and unmanageable, and then we're struggling with locums and trying to get people in, and again, that ever increasing circle? So, I mean, are we in danger of that, or are you confident it's under control as best as it can be?
I don't think we're in danger of that at the moment, but the numbers are pushing up quite significantly, so we need to be aware of that. There's a lot of work going into the system to regularly review children's cases, So we have a group of consultant social workers who work in the system to review cases that have been open for a particular period of time, or children of a particular type, to make sure that they are getting the service and support that they should be having, so that we can pick up red flags effectively about teams that might be struggling more than others, or areas where we might need to put in more support. Putting in more support is tricky, as I've said, because if we don't have staff, it's very difficult, but we can recruit social work assistants, and we can use our family practitioners, family intervention practitioners more if we require to do so. But actually all it does is take resource from one bit of system to the other. So we have to be quite careful to balance that. Otherwise we can escalate work from an early help phase into a statutory phase quite quickly, because we're using the early help resource in the statutory system. And it just means we're taking resource away from where it needs to be. So it is tricky. It's a really difficult task to balance it on a regular basis. And what we need to do is recruit staff. If we could recruit staff effectively, then we would not be in this position. We are recruiting newly qualified social workers, although there are very few in the market. It's the numbers have reduced significantly. We do have social work apprenticeships in the authority, so degree apprenticeships, so any member of staff in the children's services and across the authority can apply to undertake a social work apprenticeship to become a social worker in Somerset, so that gives us a bit of capacity. And we do have a much larger number of social work apprenticeships than most other local authorities in the region, which we did intentionally to try and bolster our staffing as best we could internally.
And just a quick note in relation to you talk about caseloads. One of this committee has looked at the caseloads for social workers previously, and one of the things that's clear, it's a bit more complicated than it sounds. In an ideal world, it's X number of cases per head, but the more complex, the less cases, the less complex, the more cases. So it's a variable scale, which I think is an important point to make. John, if you want to just come in quickly, please.
Yeah, just really fast, Mr. Chairman. Briefly going back to Councillor Hadley's point about paying a little bit more to get the people in. I appreciate we have scales, but we do vary those sometimes, don't we? For example, when we employ a senior member, we have to actually pay more to get the right person. Doesn't that apply to this as well? And I appreciate this may not be perhaps for this service. It should be a general council view, perhaps, when I don't. What we pay, you said 30, between 30 and 50, 30 and 40. So if we pay 35 to 45, for example, or just a tad more, just to give that a bit extra to those people coming in, because it is a specialist area, is that there has to be a way around this. If we were a private company, we would just do that. And I think we need to adopt that approach to overcome this problem. Thank you, Mr. Chairman.
I'll just jump in and give you another perspective on that. Where do you stop with that? If you start, every element across the council has that demand for the vast majority. So once you open the door, and the question you need to ask is where you would stop, because everyone in the, I would suggest, everyone in the council, every team manager, every executive director would be saying, well, I can give you examples where that's the case. Do you want to come back, or is that?
I mean, that is an issue, and it also has an impact in terms of the region. So there is a bit of a rush to the top in the region. So people constantly, if we put it up by £5,000, then somebody else put it up by another 2, and then somebody else put it up by another 2 or 3, and that's not sustainable. So we have historically relied on the fact that Somerset is a good place to work. We have a good culture, good support, good management support, shared risk, to encourage social workers to work in Somerset and to stay with us. We need to balance that out a bit sometimes, which is why we have retention payments for particular levels of staff to ensure we have the right staff in the right places. But it's quite a difficult balance. And at the moment, I don't think it's necessarily about pay and conditions. I think it's more about people not wanting to be in the profession because of the difficulties of just working in children's social work, and the pipeline for social workers coming into the system is really slow and poor. So we have a degree programme for social work in Yeovil College, which attracts local people. They're currently having a fallow year because actually there aren't enough people coming in who want to take a social work degree. And that's the situation nationally. That's a real issue for us, and that's where we need to focus.
And it would be remiss of me to say that the system is broken and we need to find a way to. Moving on. I will carry on now. Claire, next one, please. Richard.
If we could go back to the previous slide, that's got a bit more information on it. So neighbourhood working, so there's a big explosion in neighbourhood working happening across the county at the moment. Is that working? No.
You're back on.
Yep, next slide. Cool, thank you. So big explosion across children's services, adult services, health, including SFT, and Suffolk Foundation Trust and the Integrated Care Board, ICB. They're both, again, going for locality working as well. So that big increase is really beneficial. What we're trying to do is improve the relationships on the ground between professionals. They work more closely together. We're maybe a bit less reliant on process, more reliant on human relationships in order to wrap around families, give additional support. And we think that will help us to really pick up cases much earlier, support schools and other professionals locally, that type of thing. So there's a big sort of shift in that direction that's happening. As part of our work, we're anticipating consultation in September with implementation in the new calendar year. So we're just sort of starting to prepare for that a bit. Obviously, we've been thinking about this, doing quite a lot of it. The Connect Somerset programme covers a lot of that work as well. But we've put a couple of workshops in place. So the first one was in Wincanton, second one in West Somerset yesterday. So I was there talking to colleagues, and we're really trying to learn what happens locally, what the strengths are, what some of the gaps are, what can we do to take away some of the barriers to people working closely together. Particularly West Somerset, there's a lot of learning about what's happening. So we're going to kind of where the energy is at the moment. And in Wincanton, again, lots of learning with the primary care network as well. I should explain our neighbourhoods and localities. So neighbourhoods we've got 12 areas for children's services, same as 12 areas for adults, slightly different geography, but very, very slightly different. And that's all coterminous with primary care networks. So the aim is to try and work really closely with health and to get people to know each other well. So we therefore have to operate in the same space as our health colleagues. So that's the intent behind that. And for localities, we've got 6 areas that we're working in. That's mostly around the education work that works better in terms of the support for schools. So that's what we're putting in place there. And obviously we are still working very closely with local community networks. And so this isn't about an exclusive approach. This isn't about kind of hard boundaries. This is about being permeable and working across fuzzy boundaries and all that type of stuff. It's really just an enabler to get people to get to know each other better, so they work closer together on the ground. So that's the kind of neighbourhood working. There's an update here about our FIS practitioners. So our FIS practitioners are working very closely with schools and with Connect Somerset champions, and also with our parent family support advisors as well. We're starting to do case management, case supervision rather, for parent family support advisors and to support them to do a better job within schools too. So all that's going on at the moment. In terms of the workforce training programme, we've got some aspirations. If you look at other places like Wigan, quite a while ago, they put in place a big induction programme, but it's across all of healthcare, education, children's and adults, the whole system. But an induction to say, look, this is the Wigan way of working. This is kind of what our culture is and how we need to operate together. I think we've got some aspiration to do that, but it will take some time to pull that type of approach together. It requires systems leadership and various chief execs signing up to it and saying that's a good idea. So it's something we'll work on rather than deliver quickly. I'll pause for questions on that one, and then we'll go into the early help for families.
No questions, so carry on.
All right, good. So if we go to the next couple of slides. This priority, families can access support early. As Claire said, we've got 2 elements to it. One is best start in life. So this is starting to be pulled together across a range of different partners. It's really about those children, particularly sort of -9 months to 2 years, but then on to 5. So that best start in life is helping children to be ready for school. And then Connect Somerset, which colleagues are aware of, we've done previous presentations around, but that's effectively trying to increase the amount of early help we have in communities and how families can access that as well. So this is about a big increase in early help, lots of support locally, trying to identify and support people locally and take away the barriers that are stopping people from working really well around families at the moment. So quick update on these areas. So joint area inspection last month that we had included 2 meetings with Connect Somerset. So the first one was Connect Somerset Champions that inspectors met with that had some very good feedback. And also Holyrood Academy, where there's some excellent work going on in terms of support to the community from the school. So the school being a real anchor in the community, which is one of the things we'd like to do elsewhere across the county. Some of our digital work's going very well. So we've been rolling out the Transform Family View. So Transform Family View is a database with about 1,000 different streams of information coming into it from lots of different partners. So including mental health, police, probation, obviously children's services, social care, all that sort of data is coming together into one place so that we're able to present information about the needs of children and give some insight into the support that's required for a family, that type of thing. So Transform Family View, we've kind of shifted it onto a new platform. It's called Azure, so Microsoft Azure for those who are techies. That enables us to do some really flashy stuff. So this gives us a new platform to be able to do lots more things in the future. That's rolled out to social work already and FIS, Family Intervention Service, and is rolling out to schools in the next few days as well. So we're really pleased about that, and it's starting to get a lot of interest across the system. Lots of partners now coming to us, so GPs, for instance, wanting to have access to this data, lots of others as well. So really exciting, and lots of things we've got planned in terms of helping staff to just do a better job, better insight, that type of stuff. The other part of what we can do is around digital is the case management systems. So we have a case management system for social work called the local Liquid Logic, so LCS, Liquid Logic. That's got an element to it called Early Help Module, the EHM. And the Early Help Module is what's used as the portal by Family Intervention Service for their case management. So we've got around over 100 staff using that at the moment for that work with families. What we're going to do is replicate that and then have basically Early Help Module access for partners. So this is the first time we're opening up a social care case management system so that partners can access that information as well. It's really exciting, will make a massive difference. And some other local areas have done this before, and you start to have one case management system that's across the early help system. So we're starting first with parent family support advisors because we really need to support them and help them to work effectively. Then we will ask schools and also voluntary sector providers, so those colleagues who are also using Transform, if they want to join us on that case management system. So it's helping people to develop that professional approach, but also allows us to quality assure the early help system in a way that we haven't been able to before. We know how well how effective it is, how well we're doing for children and families. And then another digital bit is around children not in employment, education or training. We have an old algorithm that we've used. It's a national algorithm called Ronnie, something like that. And that's being that basically identifies children who will be at risk, might be at risk in the future of not being in employment, educational training, and that allows schools and other professionals to be able to put some additional support in place. We've been working really hard on our database because our data set's much bigger than the one that Ronnie accesses, and applying artificial intelligence to be able to really identify who might need that support in the future. So that's something we're putting in place at the moment. It just does the same job as the previous algorithm, but we think it's much more accurate. That's being verified at the moment by Edinburgh University, and I'm meeting with them soon to get a bit more information on that. That will be put into Transform Family View, so a school can see the risk of a child becoming NEET and also have all the guidance and support there on the same page in that app to help them to do something to support that child, young person. I'll move on quickly. So around Best Start in Life, we've got 10 areas with postnatal parenting support. We've got a forest programme, which I think colleagues have heard of before. It's run by Health Visiting, where it's more intensive support. That's in Chard, Yeovil and Bridgewater. And we're really starting to bring together what maternity is doing around this area with health visiting and with some of our community partners as well. Starting to pull together an antenatal education approach, I suppose. It's early days, but what I'm really excited about is if we can get that in place and support more families early on, I think that will help with readiness for school and some of the challenges that we face in terms of speech language communication needs, attachment, that type of stuff. But also it gives us a foundation to start building a family hub model. It will be distributed across our 100 hubs that we have across the county, but a distributed family hub model, which would be really good. But we've got to start with best start in life and early years. In terms of challenges, we do have gaps in comms, having another big push around the comms for Connect Somerset, just recruiting some additional capacity at the moment, and we'll start off on the Help for All campaign, so you'll start to see more information about that, and that will help enable more families to be accessing early help. And for public health nursing, the Forest programme has dedicated funding, which is only for 2 years, so that's another area to be mindful of. And you've see the lack of digital capacity for the Help to Help Yourself database as well that's listed on there. So I will pause there.
Members, any questions? I've got one then. Data, one of my favourite subjects. You talk about streamlining and having a shared system of comms. Does that mean we've overcome the problem of sharing data now?
It's not easy. But I think there's been a lot of work for the last 10 years, particularly Jill Baller in our team who's been running these Supporting Families programme, has for 10 years been working on that culture of data sharing. That's really apparent. And what's happened is we've been asked by the Department for Education last year to write some national guidance on that data sharing because we are ahead of the rest of the country. And we're also being paid to support around 30 local authorities in their data sharing as well. So I think we've done quite well in terms of how the rest of the country is doing. We're ahead. It's still challenging. We still need to work really hard. There's a huge amount of bureaucracy to put in place in order to be really clear about the legislation that we're using, make sure that parents and families are aware of that use of data and how we're bringing that together. But I think to a certain extent, we've got the right processes in place. I'm confident around that.
I remember the first time I sat here as chair of this particular scrutiny committee, and one of the first items on the agenda was data sharing, and it is somewhat of a hobby horse of mine to keep going back to. So what I'll ask is, with the committee's permission, I'll ask Fiona, our clerk, just to make a note of the fact that it may be worth bringing back to a future meeting about data sharing. And how it works, because very often one of the problems we've heard over and over again is that there are so many different silos, different partners, different stakeholders working in this environment, none of which are able to find a way to sensibly share the data, which means that, because one of the biggest frustrations I always hear from parents or children is that we keep having to repeat ourselves and things are missed. So that would be something that we made to look at, Richard.
Yeah, and I'll add in as well, it is genuinely quite exciting at the moment what we can do around the data sharing. So when every member of staff needs their own sort of case management system, every sector needs their own case management system. But by introducing a common case management system, the early help module that I talked about, that starts to give people access to other people's records and have shared records and shared stories that we tell so that families don't have to say their story twice. The other thing as well, the transformed family view, but also CIDR, which is our shared case management, shared case records in the health system. They're starting to have contextual lookup buttons. So if you're in your case management system, you can click a button and go straight into Transform and view that child without having to kind of log in, go into this different place and, look up the child. You can click on the button and go look at the health records as well straight away. And so and this is all on a browser. So it's starting to feel like these are parts of the same app for the first time and same kind of workflow. And that's a really big change. And what we can do with Transform as well is, because it's pulling in lots of partner data, but also because it's on this new platform, is start to visualize that data differently. So I think Transform will develop over time into being almost a graphical interface to the data to be able to tell you and give you that insight that you need about families, about their needs, how things are developing. Which goes really neatly alongside your own case management record system.
So, Fiona, if you're making that, we'll have we'll look at that. That would be interesting because because it might give the committee the opportunity to add some support and some pressure behind it. Francis.
Thank you, Mr. Chairman. Music to my ears. It's great. It's fantastic. And I know it's years and years and years of really hard work. But I do have a question, which is about permission. And are parents actually aware that health data is being shared when they are talking? Where are we on the difficult bit of making sure there's consent?
I think it's one which we could explore in more detail at the next meeting if we have a session particularly on data. We have worked quite hard to make sure that information is online. When you receive a letter, there's a link that takes you to our data sharing approach and things like that. There's possibly more to do in terms of general awareness, but we are using the legislation and what it allows us to do at the moment. And there has been a shift of emphasis, I think, from central government, not so much a change in legislation, but shift of emphasis, which is more enabling about sharing of information as well. Claire, if you want to.
We'll bring it back, Francis. So.
And the one sentence is, being in front of the Information Commissioner is trumped by being in front of the coroner, always.
Thank you. We'll bring that back, members, to where we are. Okay, do you want to move on to the next one? Thank you, Richard.
Thank you. So this one is on sufficiency of homes for children in care and school places as well. The initial report focuses a bit more on sufficiency around children looked after. We are working on a sufficiency strategy for special education needs and disability places, but that's something that's an ongoing piece of work. So we've just focused for now on children looked after. Jane also is jointly responsible for this area, so I'll bring Jane in a minute. So we're the main things to report on really are Thrive 16 Plus is one of our really big programs of work. So that's for supported accommodation for children who are over 16, and it's put in place at the beginning of this financial year. And the two YMCAs are our main providers for that. Homes and Horizons, which we've already discussed, and we're also working quite hard on developing local relationships as a kind of catch-all sort of approach. There has been a significant increase in demand, and that's kind of really marking our approach. And whilst we work really tirelessly across the whole system, including our social workers, our leaving care teams, and the brokerage function that we have in the home team, and the commissioners all the time are working tirelessly to try and reduce costs, try and make sure the right packages are in place, and children are moving on at the right time. Nonetheless, it is an uphill battle against the market that is at times pushing the prices a little bit, let's say, and also that increase in demand that Claire's mentioned earlier. So good things. So we've had some incremental improvements. We're testing new approaches. So there are 3 additional move-on properties that we've been doing up. These will be temporary for a couple of years, but allows us to have move-on for children coming out of Thrive 16 Plus. It's one of the challenges that we've got is having enough accommodation for those young people to move on to. So that often blocks up, I suppose, the flow of young people coming through our services. We've also got a pilot to rapidly move more children from residential provision into fostering. So they might start off there, but in maybe 12 weeks' time, the expectation is they move to fostering placement. That's really exciting, but we've just started with one provider at the moment, and we'll try and increase that. Thrive 16 Plus as a service, as a contract implementation is going well. Panels and provider development we think is going well as well too. It's not the same as the previous P2I Pathways to Independence programme. It is different, as a higher level of need of children coming into it. And we've got various reporting and things which we're trying to put in place as well at the moment. But that's functioning well. And the inflation negotiations that we had at the beginning of the year went well too. But we know that over the course of the year, there's a financial pressure on every new placement that's set. So that tends to undo all of our hard work. In terms of challenges, we've talked about the continued delays to Homes and Horizons and the annex to the pods. The full projected savings for Thrive 16 Plus that are in the MTFP, so medium-term financial planning are looking like we're not going to deliver that whole amount due to that additional demand, because there's a lack of move-on accommodation and because there have been some delays in moving young people at the beginning of the year because they've got exams and things like that. So we need to be really careful about those young people's needs. There is a review that we're currently doing, and there are mitigations that we're putting in place at the moment to try and recover some of those savings as well. It's unlikely to do the whole amount, but we are pushing really hard to put that in place. In terms of demand, we've now got 611 children in care as of this morning, and there's been that escalation in youth violence, which is coming through into our services as well. Areas for kind of challenge and escalation. So that lack of private rental accommodation or affordable rental accommodation, and then housing for care leavers is important, and that rising demand is the other thing that we were escalating as part of the transformation programme governance. Jane, can I hand over to you?
Thank you. And I guess there's probably not lots for me to add that hasn't been said, but I think one of the things I would want to say from a practice point of view is all of our staff and social workers are fully committed to ensuring our children live in homes that are the right ones for them, the best match for them, that can meet their needs and help them to grow and develop as we would want them to. And clearly, with a lack of sufficiency, both locally and nationally, that makes that incredibly difficult. We very rarely have choices of homes for our children, for us to consider lots of different ones to make that choice. And often it requires the skills of social workers and other staff to say, well, we have this option as a home. How are we best going to make that work for our child and ensure that right package of support is put around? So I think it's just important to say that we're, driving that relational model of getting the very best that we can against a national picture that is incredibly difficult to enable us to do that. And I think with regards to the care leavers, whilst we've got the rent guarantor scheme in place to allow them to move on, actually identifying properties to enable that initiative to happen, again, is incredibly difficult. So we have identified those care leavers that are ready to move into their own accommodation, and we're able to support them with that rent guarantor scheme. But actually, again, it's finding those properties that will enable them to stay in an area they're going to work, where their support networks are, where they want to maybe start a family, whatever that might be, again, makes that incredibly difficult.
Thank you. Members, any questions or comments? What I will say, Jane, you made reference to it there, but I'll support. The job of a social worker isn't just the social care element. It's a matter of being able to be an improviser, a developer, and to find ways forward and juggling things. And it's something that we don't always recognise, the fact that when young people are in a real situation that something needs to be done. It's okay when we're talking about permitted, not permitted, and stuff. Sometimes at 5 o'clock on a Friday afternoon, I can't imagine the stress that some social workers are going through trying to find solutions in the short term, and we need to recognise that, I suppose. That's why I mentioned, just so that members are aware. I won't ask you to comment, Jane, but Marcus.
Thank you. Just picking up on, you talked about the work you do with the 2 YMCAs, etc. And I believe there's in Newcastle. And were they, because obviously I know about Bridgewater, I know about the work they've been doing in Minehead, etc. But are they geographically around the county? Because being in the West, I know what I know, and I just know there's Bridgewater. I know there's the ones in Minehead. Are they? And I know there's. Do we work with the one in Taunton as well, or are there others around the county that we work with? And you touched on the going from residential to fostering after, and how I think we use the word excited actually, but how promising is that, and is it a new thing, or is it just something that's developing? Can you just expand on it a bit more if you can? Thanks.
Yeah, of course. Thank you. So during the contract, we split the county into 4 quadrants. and we've made sure we've got sufficiency in each of the 4 quadrants as part of the Thrive 16 plus contract. So yes, we do have sufficiency in the right places. We've taken a bit of time to build to put the accommodation in place in some areas, but that should be on board soon. And Jane might have more detail about exact locations if that's helpful. And the second question, sorry, was.
I was just, you touched about moving from residential into fostering after 12 weeks, and it seemed to be that was a new thing, was it? Or
yeah, I mean, obviously we try all the time to move young people. We have a lack of sufficiency of fostering, which means that we do have some young people who are in residential care who would be better suited to be in fostering. And so whenever the opportunity arises, we are moving young people. However, because of that lack of sufficiency, it's really difficult. But to have an agreement with a provider when a young person comes into residential, that over a period of time, they will work with that young person to then move them into fostering, which is their own fostering provision, is quite a new thing for us, but one that we'd like to repeat with other providers where they have the capacity to do so. It helps to build up the relationships with that fostering provider quite early on, and it is similar to what we're trying to do with Homes and Horizons as well, where that fostering is linked into homes, and the workers know each other well. And there are other schemes elsewhere in the country where in a residential home, they are also qualified foster carers, and you're starting to kind of see a bit of a blend between those models happening. So yeah, we're open to trying things at the moment to see what works.
What I will say, and forgive me for the officer dealing with this, but obviously the Thrive, the new pathway to independence that we have is a relatively new system, and I'm pretty certain members, if any of you are interested, you'll be able to the team would welcome an agreed time when you go with them to have a look at what we've got, because it is really inspiring, some of the things that we're putting into place with this new system. And I would highly recommend, what I'll do, Fiona, if you can make a note to ask, and we'll circulate the contact details so that members who want to find out what's happening in their area can do so. Okay, there no being further questions, that's fine. So that's item 6 of our agenda, I think, finished. Are you happy with that, Claire? That's okay. So what we've got, as it happens, I'm running slightly behind now, so that's a good thing for us. It won't last. If we like, I'll take a comfort break. So I'll restart at 11:30.
Hello?
It's 11:30, so we're looking to move on. Members, thank you very much for, hope you enjoyed the ability to stretch your legs a little bit. I'm just conscious that Amelia, who was going to present, lead on that one, so so we're moving on then to item 7 of our agenda, which is our education, health and care plan, and annual reviews update. I'd like to introduce Amelia, I think, who's leading on this one. So Amelia, please. Thank you.
Thank you. And ironically, we were just discussing education healthcare plans and the funding thereof. So it was very, very appropriate. But sorry, hold on. So I believe there was a report that was done for this committee in December. So this is to serve as an update to that report. But also we've just had a conversation about the Children's Transformation Plan. And one of the projects in that plan, in that programme, is relates to education healthcare plans, the process that we undertake to do those assessments and to compile those plans, and the communications surrounding that process. So we just want to touch on some of that. So we will update you around the local government ombudsman actions that were shared in December. I would also just give a general update on where we are with this important part of the system. So you can take us to the first slide. We have been through a period of really quite significant growth in the volume of plans within the county. That period of growth is now tapering off. So we were not accustomed to any growth. We became accustomed to rapid growth, and that is now tapering off. So you can see that at the end of 2023, we're at 5,545 plans. And this year it's slightly lower, 5,395. That is still a growth in the proportion of children who have a plan. And that's because we have fewer children than we had before. So you can still have fewer plans, but still some growth there because the total number of children that we have in the system is going down. And we've touched on that on other occasions. We talked about the declining birth rate and the reduction in number of children that we're educating. But overall, the plans that we are supporting are marginally down. The next slide. The proportionate to the size of the system, we have also seen a decrease in the number of requests for assessment. So the number of children being put forward has gone down. So there were 940 in 2023 and there were 835. So that's quite a steep decrease. Now, an 11% decrease in requests for assessment doesn't result in a 11% decrease in the number of plans. And that's because children quite often will retain the plan for longer than they might have done in the past. So those two things will track each other a bit because you'll have fewer requests for assessment will result in fewer plans, but you may have more children staying on as they move into post-16 and their entitlement is higher than it may have been. The government's target for the completion of a plan is to do so within 20 weeks. We have had in the past some strong performance. So in 2021, we were above the national average and above the Southwest considerably. In 2022, we were far above the Southwest and again above the England average. In 2023, this dropped, and it dropped below the national level. We have been tracking that over the course of the year. It bumps up and down in any individual month. There's a few reasons for that. I mentioned earlier in relation to the current programme and our immediate focus on one of the big contributors to the sharp reduction in timeliness has been the number of children who got stuck. So if you have one child, probably won't make a big difference in the overall timeliness. If that one goes on quite a long time, we had quite a large number of children. To the point where it came into post on the 1st of April, we estimated there were around 140 children. I think as we started to dig through the various lists, that grew considerably. We were also able to resolve a number of those. I think we're in the region of about 80 that have been resolved, but more have come onto the list. Now, with such a very large number of children, some of whom the delays are quite long, has a significant impact on timeliness. So there's a big focus now on doing things, getting back to past performance. But also, it's not just about government targets, is it? Because the government target behind each one of those delays is a child, is a school, is a family, a parent, a carer, and time matters. It matters because of the child's progress, and child's lives feel long, but they are short, and all of that time learning matters. But also it has an impact on the mainstream school and their ability to cope because they don't get the money until they get the plan. Move to the next slide. The area that we are really focused on at the moment, where we are concerned about the trajectory, is in relation to tribunals. And we have seen a really marked increase in tribunal appeals. That was in 23-24, and that pattern has continued into this year. The driver for that sharp increase is our turning away people who have come to us for an assessment. That is something that we are looking at in terms of our practice and our policy. Now, sometimes it is absolutely the right thing for the school, the child, the parent, and the carer to watchfully wait and assess and look to see if the things that are being put in place are going to have an effect. I have in my inbox a head teacher saying, you've moved too quickly into assessment. We haven't had enough time to see if the things that we are trying are going to have an effect. So waiting and seeing is not always detrimental. Sometimes it's the right thing to do, and that's why we have a graduated response. So the team has been saying to people, have you been through the graduated response? We have a very effective model that has been praised by external agencies. Have you gone through that process to see if things will work? But we need to just check, because of the real push for tribunal for that particular response, we need to pause and ask ourselves a question. Are we pushing back too often? We are also, in relation to the transformation work, and we've been talking to school and early years leaders about the potential to assess without an EHC statutory assessment, because when we speak to parents, what they are looking for is for an expert with specialist knowledge to come and to assess their child. And at the moment, the only way that they can do that is through the EHCP route. But that is a means to an end, and the end is the assessment, and we can do assessment that is more light touch, that is more rapid, and that is more responsive without going down the EHCP route. And there has been a positive interest in from professionals and parents in us and exploring what that would mean for them. So we will be actively looking at that. Move to the next slide. Another area that we are very mindful of is annual reviews. We are particularly having some detailed conversations with our special schools, because you will imagine that in any given school, where there'll be a relatively small number of children with a plan, a special school will have all of their children with a plan. So this is a very significant issue for them. And annual reviews should be a live document. By law, they should be reviewed every single year. And then the school, parent, family, child coming back to us to make any of those changes. We have seen a reduction in requests for change. Now, that may be because the changes that are being made don't require a change to the statutory plan, or it may be that a reduction in the likelihood that we will make that change is leading to fewer people requesting the change to be made. So in the same way that we have asked professionals to go through the graduated response and therefore accepted fewer of those requests for assessment, we are making statutory changes to fewer annual reviews. So again, we will be pausing and reflecting on that approach because it is important that a plan is up to date. Now, that doesn't mean that every plan always needs to be reviewed because it's what's the doing that needs to be updated. That's the most important thing. But we do just need to check and see what the drivers might be for that decrease. To the next slide. So when we met with you on this topic last in December, we had an investigation that we were reporting against. What I'm just going to ask Claire to update you on is what the team have been doing in that time. And then we'll just come back to reflect on what that means going forward. So this is a 6-monthly touch base from that last report.
Just before you bring Claire in, I'm just conscious, forgive me, I don't mean to put any bits, I'm just watching the time. So if we could to move it along, I would appreciate it. Thank you.
Thank you. Hi, everybody. I'm Claire Merchant-Jones. I'm head of SEND within the local authority. So I saw some of you in December where we talked about the LGO investigation around annual reviews, and we agreed and signed up to 3 activities really that I wanted just to give you a little update on where we've got to with those. I think it's really important to put it within the backdrop of all the things that colleagues have talked about this morning around transformation, and I think you've heard some really exciting new ways of working and pausing how we approach things currently to think about how we're going to do them in the future. And all of this needs to be taken in that context. So what I'll try to do is guide you through where we've got to with the actions we agreed and where that sits in the next part of the transformation journey. So we agreed when we met last time that annual planning meetings would be stood up so that schools could talk about the children they were most worried about and identify those where they felt changes were needed to their EHC plans. We were going to clarify expectations with schools to make sure that appropriate advice and support was available in advance of the meetings. And we were going to ensure there were the right staff in place to process annual reviews in a timely way. So if I could have the next slide, please. Thank you. So we offered annual planning meetings to every school across Somerset. It's been viewed as a really, really positive piece of work that the local authority undertook jointly. So we brought our advisory teams together. We met with every single school. And as a result, I think over 2,000 children were discussed and 900 children have had involvements from the teams. What we've recognised, having done that 1-year cycle, is it took a whole term to do that piece of work. It was hugely resource heavy. And of course, what you give with one hand, you accidentally kind of remove from the other because you haven't got those people in doing the work with the children. So through the redesign of Team Around the School in the transformation plan, we're going to really think about how we identify schools that will need that help the most and really focus and target efforts in there. And that'll be picked up within one of the transformation projects. We really want to focus lots of effort around transition. So those of us who are putting together project plans are really thinking about those key transition points and what that means for children and how we can identify the work that needs to go in before annual reviews or other pieces of work are submitted. And then we're thinking about how we bring teams around children to talk about children with their families and with their schools more regularly and routinely than we're doing at the moment. So in this bit, really successful. first go at annual planning meetings. Even better if will be as we go into the next model. But by and large, really successful around annual planning meetings. And I think linking back to the amendments that we've seen that potentially haven't been requested for this year. So we've clarified our so if we go on to the second action agreed, we've clarified expectations with schools. We offered training and guidance. We've undertaken that with schools in relation to expectations. So as Amelia said, the graduated response, what we expect schools and to be undertaken before they would look to amend an EHC plan. And we think as a result of that, there's been a decrease in the number of amendments and absolutely linking to what Amelia's saying, it's right and proper to pause that work at the moment, because what you don't want is to de-incentivize, if you like, people asking for help at the right time. It's just how we put that help in and making sure it's timely and able to be agile enough to meet a child's needs. So the next steps really are trying to reduce the conflict out of the system. Annual reviews are used sometimes to make something happen. So making sure that we've got a system where people can ask for something to happen, to get a team around a child early as possible, doesn't need to be as a result of an annual review. And the more we can talk to that and build that within our transformation plan, the better. And again, effective use of team around the school, team around the child, and the use of graduated response for children with EHC plans. And then finally, we committed to additional support staff being in place to process the annual review reports. Well, we've had support from the local authority around increased investment in that team. The difficulty is the job's not that attractive to people sometimes. It's a really tough job. We've talked about social workers and retention and the lack of morale in some teams, but particularly within that statutory send function, the capacity of that and the turnover of staff does make it difficult to always meet the demands of the statutory processes. So it's a really exciting piece of work to redesign those EHCP processes through transformation and really think about what those roles and responsibilities should look like so that people can come to work and really enjoy their jobs. And Claire talked earlier about social workers having parts of their jobs they enjoy. I would take that across every single person working within our system. People need to be able to want to come to work and get on and enjoy parts of their jobs. And I think there is real issue within that statutory send area. So all of the next steps around that is enabling plans to be updated, but we know we can't do that in our current digital system. So we're looking at other systems to support that. We are, and that requires support across what we use in our how we record data and how we record information about children, and redesigning our internal processes to digitise in use of technology. And you know, we know our schools are really up for that, and we're really up for where that challenge takes us. I think that's me, Amelia. Thank you.
I just realised that I was a little bit more abrupt than I meant to be previously, and I apologise for that. I didn't mean it to say that. I was trying to say concise, and my head got in a mess. So I apologise for if I came over a little bit more abrupt than I meant to. I apologise. Were you looking to finish up, Amelia, or is there any question? So I was going to start off with the Claire, I'll jump in. So it's data again, I think, with systems, system barriers. Was that, you talk, requiring corporate change in your last slide, the next steps it talks about, is that data again that's causing a problem?
I'll say yes, Lee, because I think that'll make you happy. But I think that it is about systems and about having a really good agile recording system. Currently we use one system, and we're looking at others that will allow, you know, in an ideal situation, you can live update things that aren't going to make much difference to other people if they're outdated, but make really massive difference to children and families about them that we currently cannot update. So yes, it is.
Thank you. I got a hand, Ruth online, and then I've got Marcus and John and Toby.
Thank you, Chair. I have two questions. So my first question is that on the first slide, you talk about a focused effort in January around ceasing plans. Now, obviously, to legally do that, you've had to do annual reviews. I just wondered, looking at the data, it's really hard to tell, but could you just explain a little bit about how that impacted on the compliance in the rest of the process? Because obviously you didn't have additional capacity to do that. So what was the knock-on effect? So that's my first question. And then the second question is around the tribunals. You talk about the fact that tribunals are linked to saying no to assess, what I'd like to know is really what the success rate at tribunal is, and actually what are the cost implications, because my concern is if we're going to tribunal and tribunal then saying, well, you've got to assess anyway, we've then taken up a lot of time and there's a lot of cost that's involved in that. So those are my 2 questions. Thanks, Chair.
So, thank you, Ruth. I'll take the ceasing plans answer, and I don't have that information for you really, Ruth. I don't think it did have a disproportionate effect on any other part of the system. We just recognised that we absolutely needed to focus some efforts on ceasing EHC plans where they were no longer necessary. So I don't think I have an answer to what your question is. And I think it's about what did you stop doing to do that work, given that the system's already under quite heavy pressure.
Okay, thanks. Can you come back to me with that? Is that okay? Okay, I'm happy to have a conversation outside if it's easier. Just
of course,
I'd like to know the impact, because obviously there must have been an impact somewhere.
Yeah, Ruth, on the question of tribunals, as I indicated, I think when we look at the data and we look at that sharp increase, I think that's really driving us to ask the question about the process. And I think it's absolutely appropriate that we are measured and we use the graduated response and we do things that are at the right time. But I think we would absolutely agree that when you see a sharp increase in tribunals like that, it leads you to ask the question about whether that's the decision making is as strong as it needs to be. And I think that's the question we're asking now. Is the decision making appropriate? Because you're absolutely right, tribunals is generally not the right use of resources for anyone in the system. We want those decisions to be smooth and to be coming to the right conclusion without the need for the legal system. So I don't have to hand, which we can get for you, what the rate of decision is against us or for us in tribunal. But I think regardless, we would want to be asking questions about the increase that we're seeing.
So I think that's 2 bits to come back for. So could I ask you copy in Fiona with your responses so that we can put them as part of the agenda, part of the minutes, sorry. Ruth, are you happy with that?
Yes, thank you, Chair. I think the other thing is just to note that the presentation was quite late coming, so that hasn't allowed the public to have an opportunity to ask any questions. I think we just need to note that as well.
Thank you, your point's noted. Okay, Marcus.
Thank you, Chair. It was mainly you talked about reducing the conflict from the system. I was just wondering if you expanded that. Is that the conflict between us and others, or between parents and the assessment? I mean, you said it was about reducing conflict. What was the conflict, or what is the conflict, and is it? I assume it's working.
Yeah. So when the process goes well, it's a process where professionals and parents come together and come up with a plan that is going to help that child progress better than they otherwise would have done. So there doesn't need to be any conflict. It should feel quite positive. And I've had feedback, from parents and professionals to say that they have had some really positive experiences of coming around with others and really focusing on that child. But that is absolutely not a universal experience, because the system and the way that it works means that it can easily end up in a situation where there isn't an agreement or there isn't an obvious positive solution. And in particular, the biggest driver of conflict is, where is that child going to go to school? And we talked earlier about the sufficiency strategy. We do not have enough places in the right place at the right cost for every child to get their ideal education. And that obviously raises the stakes enormously for everyone in that situation, because a child can be not happy and not progressing in a school, but there isn't a natural place for them to move to that is ready-made for conflict, because that's a very, very stressful situation for everyone involved. So we've got a huge focus at the moment in really looking hard at what places have we got for children, what can those places do in terms of professionals there, the environment that is there, what kind of need can be met, and thinking about how do we navigate this better. And it's not that we've got no place in our schools. As you know, we've got fewer children than we've had forever, probably. And so there's space, but that space isn't always configured to meet that particular child's needs in the place that is near enough to their home. That we will find solutions, and we are finding solutions at pace, but you need to have the right head on. And in the meantime, we can have children and parents and families and schools caught in a situation that's ripe for conflict. So it's a very long answer, but it's a very kind of difficult situation to navigate.
Thank you. John.
Thank you, Chair. Amelia, yeah, you were talking about earlier about before a child goes into an EHC assessment. And you mentioned something called, which I've not heard of before, a graduated response, which I'm assuming is something the child and perhaps the parents also go through to assess that child, whether they actually, to pre-assess them, if you like, before an EHC is commenced with. I may have that wrong, I don't know. But my question is, who is responsible for actually overseeing that graduated response? Is that a council thing, or is that down to the staff at the school itself?
So we have something called the graduated response as a tool. And that's something that was produced by the team as part of the work over the past few years, the improvement work. It's been very well received. It's been updated specifically for the early years and for post-16. It's a very, very detailed resource that takes professionals through the steps that they should use to identify what a child what their needs might be, and to work through different things that they can try and that are appropriate to be done within a mainstream school setting to help a child progress better. So it's a resource that gives people lots of routes into things that they can try, people that they can approach, and things they can do within the schools. It's a very, very detailed document, but it's also a principle that you don't go straight to the most intensive intervention. You try things and you see how they work. So that's something that we've put in place. It's been very, very well received, and our teams will support schools to adopt that principle and to use those resources. And quite often when we've seen where there has been a crisis, for example, a permanent exclusion, if we go back and have that conversation, we find that there hasn't been a graduated approach taken, a graduated response to the need that has been emerging within that child's school life.
Just briefly, thank you for that. My concern is really, so my local school that I'm a governor of, it sounds like that, yes, it's on, the facilities there through the tool, but it's down to the teaching staff or somebody at the school to actually administer that. So I'm wondering where the time comes from for them to do that, this additional time. I know it's probably an ongoing thing nationally, but certainly at my particular school, I think they would struggle a bit with that, purely because it would take whoever that is away from their teaching or away from whatever it is their TA job or whatever it might be. And that to me is a bit of a concern.
Yeah, so the one thing that if you speak to, and I've had the benefit of not being kind of spent my life being focused specialist education, the one thing that everyone who has that very, very high level of specialism in my team has said consistently is that, you know, the ultimate graduated response is really good curriculum, teaching and assessment. It's the basics of good education. And that is my expertise in, you know, in terms of mainstream education, things like a really explicit curriculum, really good pedagogy and how you deliver that in the classroom. Pedagogy is the study of teaching. So it's the practice that you use as a teacher. It's a professional discipline that all teachers have and you will have different pedagogies that you'll use in different situations, but that is basics of education that everyone in the classroom should have. And what you will find is that actually It's about really good basics. That includes behavior management. It includes policy, practice, all of those good basics about how you run any school will benefit the children with the highest needs most. And that is whether they have a special educational need, whether there is a disability, whether they are coming in from a disadvantaged background and they haven't got all of the advantages that someone else in the classroom might have. So anyone who has a bit higher need benefits from the really high quality teaching. So it's not about different special other. It's about doing the basics really, really well and mindfully.
And I would highly recommend to anyone with an interest in this trying to follow a process through, because it's the different elements, partners coming together. It's what you've done and what you've tried to allow the system to move forward. It's taken a long time to move from statement to EHCPs, and where everyone is getting their head around it a lot better now than they did before. And that's one of the things that is interesting about the process. Toby, and then Henry, and then we'll.
No, thank you, Chair. My question's been answered.
Excellent. Henry, sir.
Thank you, Mr. Chair. I'm chairman of our local preschool, and we are having real difficulty in getting the EP, whatever they're called, cleared and done, because we're only a small preschool, and you seem to be concentrating on the schools, not the preschools, where it is obvious to us where the children are already in trouble before they're 5 years old. And I understand from the primary school teachers, when they come in, it's even more obvious. What are you going to do anything coming back in age from the schools? And what are you going to hope to achieve working with the small preschools? Because very few of them of any size at all.
And we met with, so we have a regular briefing for our early years providers. We met with them yesterday to talk about this. There was a lot of positivity about what we were saying, and they felt that we were hearing their concerns. And just as you've indicated, one of the biggest concerns is the workload and the logistics of engaging with the system. And as you go up the system, you know, large secondaries, there's one yesterday, you know, they've got big teams, they have dedicated staff. Our early years providers are not like that. We have childminders who are, you know, there's only one of them. We have very small nurseries and preschools. They tend to be quite small settings, and the minority will be in big chains that might have additional capacity. Even then, the local nursery or preschool is very, very small. So I think one of the things that we, because you're absolutely right, that is a critical juncture, that if we can identify an additional need at that earliest stage, we can potentially set that child on a completely different trajectory for their entire life because of what has been able to be put in place before they even start school. And I think we've all recognized that the evidence is incontrovertible. That doesn't mean we're getting it right. And one of the things that we came out of Best Start in Life work that we were doing this year was that we found that across the county, the link between our early years providers and settings and our health visitors had in many places fallen into abeyance. Things like that, making those connections, so the assessments done by health visiting can feed into the system for additional support, making the way that our providers access help really, really straightforward and simple. The funding system is already simpler, but colleagues were saying yesterday that still the paperwork and the amount of dedicated time is still overwhelming for a lot of providers because they work long hours. It's a busy, busy place in a preschool or nursery, and they haven't got the additional capacity. So that's something we're looking at, is how do we make that as slimline as possible so we can get in quickly, because those children's lives, they go by in a flash. There's not a lot of time. We've got to get in there and try and turn the dial for them.
Thank you for that. Part of our problem is that some of our parents are against having the EP, whatever it's called, excuse me, can't remember the initials, done because they think it reflects badly on their children, and they therefore make it difficult for our manager to deal with the situation. How can we overcome that? And I'm being frank here, when it is bloody impossible to get hold of people on the telephone?
As you indicated, the substance of the project is we're focusing on EHCPs, is really looking at process and communication, because that's got to feel easier than it does for some people at the moment. But I think the point that you make around, there is a perception of stigma for some people. And actually what we've identified is that you don't need a statutory process to be able to get expertise in and around that provider and that child to do a light touch assessment, and to get funding and support in for that child. There's already a flexible system, and we can make it easier, because I think it's absolutely critical. It's the speed and it's the effectiveness of that support. And the communication is really, really important. We haven't got a lot of people supporting the early years space, just looking at our capacity, our roles, responsibilities, and our process to make that stretch as far as possible so that we can be rapid in our response.
Can we have an email conversation so we can go confidential about this later on?
I was going to make the offer that if you wanted to email myself, I look after the early years send team, and I'm really happy to pick that up.
Thank you.
It's an interesting side that you've just highlighted, because one of the things I get contacted very regularly from parents who believe that the EHCP process is not happening fast enough in where it is. And one of the things I try to advocate is the fact that I use the noisy hinge example. A noisy hinge would get oiled first, so that and trying to encourage the parents to make more of a noise. But for you to say that I understand why that sometimes it's hard to get parents to engage with it. So that's an interesting change in the perspective. But one of the points that it's interesting to hear where it's going with this. All the people have finished questions, but Claire, I've got a couple for you, if that's okay. Just don't worry, it's not to. So you talk about the system and the fact that what can this committee do anything to help you get it to go a bit faster? Can we put some weight behind it? We recognise the fact that a system needs to be in place. Is it going fast enough? Can we ask the executive to shush it along a bit for you?
The data system. Yeah, I'd love you to answer
that. So in terms of the data system, we currently have several systems in children's services that are all working in different ways. So the system that Claire's referring to that works in the education services system is not working well, and historically has not worked well. I think we have historically left it to one side as this is too big a problem to deal with, so they just have to manage it. We recognise now that it's becoming a significant block in making change and improving that for staff, but also for families and children and schools. So we have very recently looked at a different system which would be integrated with the social care system to see if that would be better. We think it might be. So we're just doing some work at the moment looking at the financial aspects of that in terms of what the cost of the change would be and the reduction of using one system compared to two. And we need to do a bit of due diligence in talking to other authorities who are using that system for both education and social care in order to drive that forward.
Thank you. Rather than bring it back to the full meeting, I data nerd that I am, could perhaps have a conversation outside to maybe get a little bit more information, and then at the offer of any of the members that want that as well. But it would be useful, that's all. Thank you, members. That's no other questions. Thank you, Claire. That was okay. Looking to move on. That's item 7 of our agenda done. Then so moving on to item 8, which is children's services, the budget monitoring. Christian, do you want to come straight in and introduce yourself and off you go?
Thank you, Chair. Good afternoon, everyone. So I'm Chris Evans, Head of Financial Business Partnering. So before you've got the slides there that you can see. So this is the Children and Families outturn position for 23-24. And we'll also, management team for Children's are highlighting emerging issues that members should be aware of for 24-25. Although conveniently, throughout all of the papers we've had this morning, a lot of those issues are already been discussed, so that's really useful. So moving on to the first slide, so you see the children's services outturn there. So on a budget of 126.3 million for 23-24, the final outturn shows an overspend of 12.3 million. That is about 9.7% of the budget. However, with some of the mitigations that Claire and the team have been putting in place, that is actually £2.7 million better off as an improvement as it was in month 10. So I'll go into a little bit more detail now into those figures and numbers and so on. So as you can see there, the main overspend is through external placements, £10.3 million. So the main areas are residential placements and unregistered placements. So the registered placements is a £5.3 million overspend, and then the unregistered placements of 4.4 million overspend. So, oh, there we go. Now we're back on again. So a little bit more detail again. So we've hopefully improved the graph as from the feedback from the previous meeting, which we'll move on in a second. Hopefully, we're on a few technical issues. There you go. So we've expanded the graph there. You can see from 0 to 100. But the residential placements, we budgeted for 77 average placements during 23-24 for residential. Actually, you can see they're peaking there in March 24 of 96. Alongside that, the average cost per week, we budgeted for £6,113. In March, the average cost was 6,713. So you can see the pressure on the budget, which has led to the overall overspend, mainly through residential placements. Moving on to the unregistered placements and Homes to Horizons, you can see there perhaps a correlation between the top graph and the bottom graph. So the unregistered placements have actually come down. And obviously there you see the numbers in Homes to Horizons, our own homes, have actually increased. The salmon coloured top element of the bars are actually where children have been with us, children have been with us between 1 and 2 years. And then the darker parts of the graph are where they've been with us from less than 1 year. So currently at the end of May, in Homes to Horizons, we had 9 placements, and the top graph shows there the unregistered placements of 4. So there we go. That's some of the, but you hopefully can see the correlation there between the two. Moving on to the education side. So the in-year overspend of 14 million, which is on a budget of 112 million. The most significant overspend is the high needs block, as you'd expect, and has previously been reported. This area had an overspend of 15.1 million. So the opening deficit balance for the DSG, Dedicated Schools Grant, was 20.7 million. And at the end of March 24, the balance has risen to £35.9 million deficit, which obviously is an issue that all councils, most councils, are actually facing at the moment. So education inclusion, local authority provision. So the outturn overspend for education inclusion was 700,000. This is an improvement of 1.7 million from month 10. The SEN transport of 1.6 million is related mainly actually to inflation pressures on cost. So the cost has gone up 20%, but the numbers have actually only gone up 6%. So there is big increases in that. And then we'll move on to the schools outturn. So the schools cash balances, you can see there, are reduced from 23.5 million to 21.5 million. That's obviously going in the wrong direction. That's a reduction of 2.1 million in their cash balances. So the Dedicated Schools Grant deficit is currently approximately 37 million. If you take into consideration the schools balances of 21.5 million, this means the council has to borrow the balance of 15 million, and obviously you can imagine there is a cost to that borrowing. And then finally, moving on to give members an early sight of some of the emerging issues that we do have for children's services. So in 24-25, so a lot of this has already been covered, which is quite convenient. So there is an increase in demand for children entering care, It's 15% from this time last year, which is obviously considerable. The residential numbers are currently showing at 94 as of the end of May, and we've budgeted in 24-25 for an average children looked after of 73. So you can see again, we're already under considerable financial pressure on that. Unregistered children looked after, the numbers are currently 5, and we've averaged a budget of 1. Again, considerable costs for the unregistered children looked after. It has been mentioned as well, I think Richard mentioned earlier on, around the movement from social housing through the Thrive 16 plus contract. And as we've already covered the delays in the Homes to Horizons 6, 7 and 8. Education perspective, so EHCPs, the numbers have risen. I think Amelia mentioned that earlier on. So they were for nearly 5,000 in April 23, now up to 5,395. That's about an 8% increase. Home to school transport numbers are static, which is good. So the SEND transport for 23 average is we had 1,331 children. The average cost is rising significantly. So it was 7,100 per child in 22-23, 8,800 per child in 23-24. And well, we'll have to see where that goes in 24-25. But there is as you can see, a pressure of inflation figures on providing that transport. And then finally, the dedicated schools grant, we're already 4.2 million pressure on the 18.9 million overspend or deficit that we're expecting this year. And obviously all leading up to the statutory override in March 26 on whether the government, how the government want to deal with that, as it were. There we go. Happy to take any questions.
Okay, so just conscious that there's two elements to this, members. Obviously, there's the end of the last year's budget, and then there is where we are going forward. I was keen to have an indication of where we are going forward put into this. That's the main reason why I wanted it to come. So what I will do is my first question, not necessarily, well, it can be to you, but it might be to Claire to do. So when are we it's okay that last slide, seeing the emerging issues. We're way into the first quarter of the financial year. When were we going to see the first quarter's detail so that we can ask questions in relation to them? Because if I could probably on my own spend 40 minutes, an hour trying to understand what all the questions that last slide has generated. So when?
So Q1 finishes at the end of June, so we're not quite there yet. A couple of days, and then it usually takes how long to get Q1 data through? Question.
Normally be worked on by the accountants in July and then reported in August. But the reason the timetable has kind of been brought forward. It is common practice that the finance teams are concentrating, as you can imagine, on the first set of unitary accounts for 23-24, which is extremely complex, does take time. So it is common practice that you wouldn't normally have budget monitoring this early. However, the compromise being, as agreed with Corporate and Resources Scrutiny Committee, is that directors would be asked to provide members with emerging issues before we go into the full budget monitoring process, which you'll receive in August.
Thank you for the response. I'm just conscious. I know what we're going to be talking about in a minute and go over. I just want to. I will on behalf of this committee. I will express my frustration. The fact that we haven't got the detail to delve. It's not necessarily yours. I'm verbalising to the big thing in the middle that rather than individuals, because we are going to be asked. All the members are going to be asking, where are we financially, what we're doing, what we're doing about it. And I'm just conscious that we could potentially spend an hour talking about that last slide, asking questions, trying to understand what it is without, this is just emerging. It's not that we need the detail to be able to scrutinise it. So I'll just register on behalf of this committee to the council, our frustration, please, with because I and the committee have been asking for the detail God, I know I'm repeating myself, but it's important to get the point across. It's not right that here we are without the detail in front of us, because in a minute we're going to be asking questions about that last slide, and the response is going to be, we'll wait and see when the budget comes. This is just an emerging element where this is the direction of travel. So I'll get that out now. So please, members, you don't need to repeat it. I've already made the point that, of our frustration. If anyone wants to disagree with that, then please shout. Otherwise, in big, bold letters, it's going to be there that we are frustrated that we haven't got the detail to be able to question. Okay, I've got two people so far registered. Evie first, and then I'll come to you.
Just pointing out that Francis wanted to speak.
And Francis.
No,
Oh,
that
right.
was
So
just pointing. Sorry, that was me. Just.
then Francis, then, and then Henry.
Mr. Chairman, you'll be glad that I'm that in agreeing with you, I'm not repeating what you said. The bit that I'm slightly worried about is not specifically financial, but it's a slide, page 35 of the supplement. We have a heading of unregulated placements, but the graph shows unregistered placements. Further on, we've got unregulated, unregistered. Please, in old money, unregistered was illegal, unregulated was allowed. I know there have been lots of changes, but I'd like some clarity about what the legality of what we're doing is.
Yeah, so we do need to get the language right. So there used to be, before I think it was October 23, that any child in provision over 16, their care provision did not need to be regulated by Ofsted. So that was the unregulated element. Since October 23, that provision does now have to be regulated. So there is no such thing as unregulated provision, because everything has to be regulated. Unregistered is where it should be regulated, but it hasn't been. So therefore it is not registered with the appropriate body in terms of being registered with Ofsted, and therefore that is illegal. So there are three children currently in unregistered provision. That's the children who should be in a care provision, which is registered by Ofsted, but there is nobody in the country who's currently willing to look after those children, and therefore they are being cared for by nursing agencies or specialist agencies who are not registered to provide that care in a premises by Ofsted.
An emergency placement, really? Is that what you? That's out the? No.
No, an emergency placement I would define as a placement that it is registered by Ofsted, but is registered to provide placements in an emergency.
Thank you. Henry.
Thank you, Mr. Chairman. I just, as the Vice Chair of the D&C Scrutiny, we had a long conversation on this particular subject. Jamie's looking at me, he knows what I'm about to say. You are lucky, you have got your out of turn, because you have nothing to do with the districts. The out of turn for anything that's tied into the districts is possibly going to be September, if not later. And that is not uncommon when you go from 5 to 1. We also changed our financial system through the year, which also delays everything. We entirely agree with your comments about the lack of this year's numbers, because we are in total agreement with what you said, and we said the same thing. I think Jamie will agree with me. You can nod, Jamie. I think you're right, but you have lucky because you have your out of turn, because you have no conflicting interests from the districts.
Yeah, just if I could come back on that. So the big issues tend to be the climate and place and the communities, where you, as you said, you bring 5 legacy authorities together. We are just concluding those over the next couple of days. So there will be information going to the executive committee paper, which is due next week, including provisional outturns for climate and place and community. So that is, it won't be September, it'll be the 15th of July, I think the executive meeting is. It'll be included in the report for that.
No, I fully understand the issues, and I know that we're not alone in it, but it's important to verbalise it before we got caught up going down some rabbit holes that could have caused us some problems. So that was all I wanted to say. John, Councillor Hunt, sir.
Yeah, Francis asked my question. Thank you.
Okay, so Thank you for that. I've got no other members indicated, so I'll just do a couple myself. It's important in relation to the report we've just had presented to us that this committee acknowledged the hard work that went into reducing the deficit last year, in the last financial year, and I'd like to just record our thanks for all of the teams and all of the officers and everyone that worked hard to bring it. It was looking a lot worse than where we are. So it would be, I think it's reasonable for us to record the fact that we're grateful, because if we're talking about last year in where it is. A slight curveball, not a problematic one, but just something, I'll ask the question now. We're an increase in children looked after, Claire. Why? And is this a national thing or is it just us?
Having looked at the data, so the national data isn't through yet, but I can see the quarterly information from the South East and the South West benchmarking groups. It's an issue in both those areas. We have a low proportion of children in care, and although it is increasing, it's not increasing at a greater rate than anybody else. So we're still in line in terms of the increases. We have agreed at the Transformation Board, we agreed to do a deep dive into trying to understand the reasons for the increase in numbers. Anecdotally, having looked at the data for the last sort of month or so, there seems to be, as I said earlier, a significant proportion of 10 to 15-year-olds coming into the system, but the data is about 50% 10 to 15-year-olds, where we know there is significant elements of serious youth violence, which is an increasing issue. And then we also have the other cohort is under 10s, which is quite unusual. So we always have a sort of a number of babies coming into the system at birth, usually, where we know that parents have got issues and they can't care for their own child. But it appears to be a group with a few babies in it, but largely the sort of middle childhood, sort of 3 or 4 up to about 10, where we've had some very unusual referrals. So it is quite an unusual situation. We're monitoring that to see if that's a pattern, if that starts to become a pattern, or whether it's a blip in terms of a strange cohort of children coming in. They don't appear to be related issues, if you like. They seem to be individual issues. Obviously, it's a small number, so I don't want to describe what those are. But yeah, we are looking at that in some detail, and we will provide that report once we've done the deep dive to this.
That's what I was going to say. Can we make, Fiona, can we make a note of that, please? I think it's important. The reason I'm asking now, because if we're identifying it early on in this year, it's going to have a consequential impact as we go forward in the year. We've already, Christine has already indicated the percentage difference and that impact, so that it would be helpful if we can. Because whenever I have a conversation with people, I usually, Somerset is usually around 500, 550. When it's CLA, that's been a regular thing ever for as long as I can remember. And to hear it's increased, it just set a red flag for me. That's all. Okay. Thank you. There being no other questions. Thank you, members. Okay. Thank you, Christian team, for that. I'm sorry that I got my gun out, but I apologise. It's a bigger thing rather than just individuals. Thank you for that. And thank you everyone for that item. So item 8 then, that's concluded. Item 9 of the agenda is our items for information that was circulated between meetings. Obviously that's there. Any thoughts or questions in relation to that? Okay, there being no further business, I close the meeting. Members, thank you very much for your time. See you in a month or so's time. Thank you, everyone.